Back, and we're going to be talking about cellular adaptation. This is an important one. A lot of conditions that we'll be talking about throughout this semester. What is cellular adaptation? This is the change that cells undergo in response to any kind of environmental stress or even just normal stimuli that cells survive and maintain its function. For specific types, atrophy means that the cell size decreases. Change in the type of cell from what it should be in that area, and changes in the cells. Reduction in cell size due to decreased workload that are immobile. They're in bed a long time. Because of that immobility. Now, why does that happen? One spot and you're not moving around. And when we're moving, right, getting up and going for a walk is really such a causes them to decrease their size. They're to maintain their muscle mass. Shrinkage in Alzheimer's disease. The brain actually shrinks in size due to the chemical of atrophy. Many cells depend on special target specific cells types. So when that signal gets removed, this cell can actually shrink and atrophy. System signals are what are keeping cells to be the thing. So in the nervous system, neural signals, they get basically making them do their job the way that they should. So when that signal is right, chronic nutrient process of aging, both of these can cause cells to grow. The target tissue or organ goes through a process. The size of the organ decreases with a decreased size or function. An example of this is menopause. Estrogen actually causes the breast to cerebral atrophy is another cause or the consequence of a neurological disorder. So it can be to reduce physical or intellectual. That is so important. Which cause inflammation in the brain called encephalitis, result in loss of neurologic cells, tissue, and brain function. Loss of the neurotransmitter production in one part of the brain, in the other areas of the brain too, because they're not able to provide the stimulation to those parts of the brain. This is the risk of injury because the brain's not getting oxygen and nutrients that it needs to function. So neurotoxic injury due to things like ischemia, hyperthermia, all of those kinds of things can be really harmful. Neurons can recover from, causing them to actually necrose and Atrophy is deadly to neurons. So as the neurons decrease in size, their relationship again to the other neurons, send the signals to the other neurons, is going to decrease. They can't communicate the way they. So if they can't communicate with each other and they die, and an example of that, where there's a 50% chance that your causes an enlargement of the ventricle. It manifests again later in life, and they end up having progressive cognitive dysfunction. Cerebral atrophy can also occur due to diseases and conditions. So subcortical ischemic vascular disease, this is blood vessels have a problem and not enough blood flow in parts of the brain, and it causes reduced perfusion to the brain to show decreased psychomotor activities, executive control, and even global decisions. They're not going to be able to move around the way that they should. Multiple sclerosis is another example of atrophy. There's a loss of gray and white brain matter, which leads to the manifestations of the physical defects that we get with the muscles, because the brain can't send a signal down to the muscles to move, and it also results in cognitive impairment. Hypertrophy is an increase in cell size. Usually it's due to a response to trophic, also known as growth signals. It can be normal and reversible, or it can lead to disease like cardiac hypertrophy, and we'll cover that next. Some examples are signals that stimulate increased sex hormones cause hypertrophied reproductive cells during puberty and in the breast cells during pregnancy so that we can make milk. Increased demand, like strength building, can also increase the muscle size and mass. So some examples: adenoid hypertrophy. This is an enlargement of the lymphoepithelial adenoid, which is in the back of the nasal area, and it can be big enough, can grow big enough that it actually obstructs the nasal passages. It causes the lymph tissue to have to work that much harder to filter out all the infectious agents from the upper respiratory tract. So the effects of this adenoid hypertrophy is that the person will be snoring, they'll have bad breath, stuffy nose, sleep apnea, pulmonary hypertension, or even heart failure if it's bad enough. Another example of hypertrophy can happen in people that have hypertension, which is also known as high blood pressure. When somebody has high blood pressure, the left side of the heart, the left ventricle, has an increased afterload. And what that means is that everything that it is trying to serve, everything that comes after in the flow of blood is more constricted. So that left ventricle has to push harder, push harder, push harder to get the blood out to that side of the body. That's the increased afterload. As a result of that, again, the muscle is working harder, so the muscle hypertrophies. It gets bigger. The unfortunate thing you can see here is that when the muscle gets bigger, it hypertrophies like that. The inside chambers are smaller. Look at the size reduction in the hypertrophied versus the normal on the picture here. So it doesn't end well. Hyperplasia, this is an increase in the number of cells, and usually because there's an increased demand or there's some sort of hormonal stimulation. Some of the same conditions are going to cause both hyperplasia and hypertrophy, so oftentimes they happen together. An example here is the uterus responding to increased estrogen during the monthly menstrual cycle by increasing the number of uterine cells, and then when that falls off, they slough off and leave the body. Another example is people that live or are exposed to high altitudes. They end up producing more red blood cells to maximize hemoglobin oxygen carrying ability. Hyperplasia, some more examples: liver regeneration after injury. The endometrial hyperplasia from hormonal imbalances is another example. With hyperplasia of the endometrius, or there can also be some changes that last over a lifetime. So ductal tissue of the breast changes over a woman's lifetime. From the onset of puberty, where we have hyperplasia, we start to have an increased size of functional lobular and ductal tissues. Then during pregnancy, they hypertrophy even more to support milk production and delivery. And then in menopause, the estrogen falls off and they start to atrophy. So we end up with kind of a lifetime circuit of these changes. Growth hormone. There are two growth hormones the hypothalamus secretes for growth regulation. One is called somatostatin, and the other one is called growth hormone releasing hormone, or GHRH. Somatostatin is kind of the brakes. It is an inhibitory effect. It comes from the pituitary, and it comes from the hypothalamus, goes to the pituitary, and tells the pituitary to decrease the secretion of pituitary growth hormone. Growth hormone releasing hormone is gas. It tells the pituitary to release growth hormone to make cells proliferate. Both of these two come from the hypothalamus. They're signals that are sent to the pituitary. From there, the pituitary reacts and sends out further signals. So if these two are messed up, we're going to have a mess up in the whole process. The secretion of growth hormone stimulates insulin-like growth factor 1 to be produced in the liver, which causes bones, cartilage, soft tissue, and organs to grow. There is typically a negative feedback loop for the normal regulation. So normally, an increase in insulin-like glucose factor 1, sorry, tongue twister, would tell the pituitary gland to slow production of growth hormone by stimulating more somatostatin, which again is the brakes. When that negative feedback loop fails, and acromegaly is one condition in which that fails, then we end up with growth hormone continually being spewed out with no brakes, so nothing to stop it. And you can imagine that we end up with people that grow too much. So we'll talk about that a bit more. Hyperplasia, again, our example here is acromegaly. Acromegaly is a condition of hyperplasia that results from hormone stimulation of excessive growth. It is a form of hyperpituitarism that involves secretion of excessive growth hormone from the pituitary gland. Now, why does this happen? Most of the time it happens because there's some sort of tumor in the pituitary that's making the pituitary act weird. So this results in increase in the insulin-like growth factor 1, and that again is the one that is necessary for skeleton and organ growth to be exaggerated. So acromegaly only occurs in adults after the epiphyseal plate has closed. You remember that from physiology, that there's a certain point after puberty where that epiphyseal plate, like the knees, closes, and that's where you stopped growing tall. If you have this pituitary tumor after that point, you're going to end up with acromegaly. And most of the time, that is going to cause growth outward because they can't grow tall anymore. So what do we see in them? We see, again, that epiphyseal plate has closed, so the growth is not up, it's out, and it affects everything. You can see the picture, kind of the transition here of this lady from 1977 to 1988, 11 years. You would not see this severe if it wasn't due to acromegaly. So she had a pituitary tumor. You see, this is what she looked like normally in 1977. By 1981, her nose, her face, her jaw, her lips, her eyes, everything is changing. She's not smiling, or you would see that her teeth are becoming gapped, and it just gets more and more progressed. So what we see in them is soft tissue swelling. Patients will come in and complain about things like, my hat's too tight, my rings don't fit anymore, their gloves are too tight, their shoes aren't fitting too tight, their hands or feet are enlarging, their jaw, their brow, their nasal bone, tongue and lips, there's increased space between the teeth. They end up with pain and numbness in their hands because everything's putting pressure on their nerves. They have a deep voice, snoring. They develop coarse hair everywhere. They're oily, sweaty, kind of have stinky skin. They grow little skin tags all over them. In women, we see menstrual cycle changes, breast discharge, and in men, often impotence. How do we treat this? If you're saying get rid of the tumor, Good job. That's the best way to get rid of it. Get rid of the cause. So we're going to remove or shrink down that tumor. And then they usually will also use medication to slow the growth hormone production. Now, I want you to also know that gigantism is the same condition. The only difference between acromegaly and gigantism is that gigantism happened, they had the pituitary tumor before the epiphyseal plate closed. So their growth is up. Now, in both cases, if we don't get that tumor out quickly enough and they grow too much, again, even though what you see in gigantism is tall growth, everything else is also growing. Their heart will grow. And so when that heart muscle grows, like we showed before with hypertrophy, it's not good for the functioning of the heart. It ends up causing heart failure. And that's what they die of. So here we have some examples of metaplasia. This is one of my favorite examples to tell you about. So metaplasia is where one cell type changes to allow cells to adapt to a persistent stressor. So we'll start with normal bronchial cells in people that smoke. In your normal cells, if you smoke cigarettes, they get replaced with squamous cells, but the squamous cells are not going to be able to protect the way that they should. Another example, and that's why they end up with smoker's cough and they end up getting all of the emphysema changes and all that, because the cells are actually trying to protect against this irritant. Another example is where we have a replacement of normal stratified squamous epithelium, or the lining of the esophagus. What happens here? This is called Barrett's esophagus. And what happens is that people have gastric acid reflux. Usually that happens because there's a little sphincter called the lower esophageal sphincter, and it can get kind of loose and floppy so that it can't close down the way that it should. It'll get loose and floppy if there's a lot of pressure, like people that are obese, that are overfilling their stomach, that kind of stuff. And so that lower esophageal sphincter gets loose, acid starts to splash up. Well, when your acid starts splashing up into your esophagus, the esophagus is not designed to handle that, but your stomach is, right? Your stomach has specific cells that protect against that acid. So one of the things that the body does to try to protect, it's like, oh, wait a minute, I see that acid is coming up into the esophagus all the time. I'm going to change the cells here to be more protective. So it changes the cells from that normal stratified squamous epithelium to columnar epithelium, which have goblet cells. Again, more like the stomach. And as a result of that, they have what's called Barrett's esophagus. That is the name of it, when you see those stomach cells in the lining of the esophagus. Now, this could be the end of it. They may just be fine and they're protected from the acid and nothing ever happens. But in both of these cases, whether it's the cells changing because of smokers in the lungs or Barrett's esophagus, there is now an increased risk for developing cancer. So in both cases, we would want to be surveilling them and looking for that cancer development. Dysplasia, this is an abnormal change in the size, the shape, or the arrangement of the cells, and it usually is a cell's response to chronic and persistent stress, but it can resolve sometimes when the stressor is removed. So it's caused by abnormal differentiation, and again, that term means maturing into a different type of cells that divide. So dysplasia is a problem of regulation of cell growth. When cell reproduction occurs, the DNA can be produced with mutations, which then get repeated in all of the new cells, and they divide, they proliferate, they make more that are mutated. Although they're not yet cancerous, dysplastic cells can be an early sign that can progress to cancer. So some examples: bronchopulmonary dysplasia. Here there's a stressor that prompts cell changes that lead to chronic irreversible tissue changes. This actually occurs in little babies, infants. Some little babies, particularly those that are preemies, have to have high concentration oxygen after they're born, or they might be put on a mechanical ventilator because their lungs are not developed enough. When preemies, the surfactant, if you remember from physiology, their surfactant isn't developed yet. So we have to oftentimes give them oxygen or support through a ventilator. Well, when we do, they're at risk for this bronchopulmonary dysplasia. The BPD is a response to prolonged supplemental oxygen concentrations that are greater than room air for the newborn, and the bronchial and the alveolar tissues of the lungs become very thick in response to this. That is going to decrease their ability to take in air, and as a result, the tissues in the body don't get the oxygen and they need, and they don't remove the CO2 that they need, so it can cause problems not only in the lungs but throughout the body. Another example of dysplasia is in the cervix. So exposure to the stressor of HPV, which is human papillomavirus, this can cause the cells of the cervix to change and go through dysplasia. So the HPV gets into the cell and gets integrated into the actual genome, where it changes the DNA and causes unregulated cell reproduction. Now, not all strains of the virus are oncogenic, meaning that they can cause cancer, but we still want to look and see if that dysplasia is there, and that's why we do pap smears to look for those cells. Now, one of the good things out is that there's actually a vaccine for HPV, and it's given to both males and females because it's a sexually transmitted disease. So this is something you want to be encouraging your patients to get when they're right around the age 12, 13, that period. Now, clinical relevance. Cellular adaptation is a response to stress that can be reversible, but a persistent stress can lead to irreversible damage or disease. And when you understand these processes, as nurses, it helps us to understand what to monitor for and what to teach patients.